Hey guys, welcome to Endo Warriors. I'm your host, Callie Greenberg, and this is where we have unfiltered conversations about endometriosis, women's health, and what it's actually like living with a chronic illness. So grab your glass of wine and let's get into it. Hey guys, welcome to another episode of Endo Warriors, and I have a fantastic guest on today, Miss Melanie Wentzel, who is an international speaker, healthcare strategist, and best-selling author of Cannabis Queens. So before I get into it with her, I need to do a little disclaimer that always talk to a healthcare provider before using cannabis and make sure you check your state regulations to confirm if it is medically legal where you are. It is also important to note that in the United States, it is not FDA approved, so the quality of product can vary. It is also a very personal drug and it affects people differently. So please make sure you speak to a professional before going down that road. So before we get into the science, Melanie, I want to start with the heartbeat behind your work. So can you tell listeners a little about who you are, what inspired you to create Cannabis Queens, and why it was important for you to center women's stories in that space?
Absolutely. Well, thank you for having me. I'm absolutely delighted and I'm so excited about the community that you're building. And it's really, that speaks to the heart of what I do. I care about community, I care about health, and I care about women. So for me, a little bit about my background, I studied psychology, I became a behavior therapist and then a family therapist. And I thought, oh my gosh, I'm putting out 1,000 fires a day. How do I just work on one fire, the root cause? And so I did, and it was health system reform. So I've spent over 10 years contributing to health system reform in Australia through medical education, working with government, medical colleges, private organisations. And then 3 years ago, I got called up by the plant. And for those who are kind of not so involved with cannabis, that's going to sound very woo-woo. And I am a woo-woo girl, but I genuinely believe that the spirit of I believe all plants have spirits, and I believe the spirit of cannabis is around community and abundance. And there is work to be done that honors the women who have been doing the work for 5,000 years. So I was called into the cannabis industry, recruited in, went straight into a clinic and dispensary to learn the ropes for a few months, became a consultant, worked with over 30 cannabis companies. And then for the past year and a half, have been the health strategist and research lead for a global cannabis company as well. So my journey in cannabis has been really interesting, but it builds on over a decade of health system work. And the reason I care about it is because healthcare is people, and people are my jam.
So now that we understand what fuels your work, I want to get into a discussion about cannabis and the relationship to pain. And I live in Denver, Colorado, where cannabis is medically legal. And however, I personally have been using it since I was in high school, and some may even say that I was a pothead. But I have struggled my entire life with ADHD, anxiety, chronic pain, and that's due to the endo. And since I was a teenager and first started cannabis, I noticed that there was a massive difference in how my anxiety was controlling my life, my mood swings, the inflammation, and how it relaxes tension in our muscles. And so during that time of the month, that was crucial in my pelvic area. And I know everybody's body works differently, so I can only speak to my experience. But something that really interests me is the fact that cannabis has been around, like you said, for thousands of years and used as medicine. So in your work, you touch on how stigma shapes the way people talk about cannabis, especially women. So that brings me to this question, which is, why do you think there's so much stigma around cannabis and using it for pain when science has shown it has medical properties?
Yeah, I love that question, and it's the one that my entire career tries to answer. So stepping back just into the history, you're absolutely right to acknowledge that. And, we talk about standing on the shoulders of giants and building on the work of our foremothers. And we talk about our ancestors and people who have built industries. And I really have to tell you that women's history in cannabis has been significant. In fact, for millennia, women led cannabis. And we kind of do again today. And it's a really wonderful thing. Women are the carriers of plant spirits. Okay. If you look at just stepping again up above, that the social structures throughout history, there were a lot of matriarchal societies for a very long time. And, with women in leadership, I think there's something different that comes. That spirit of leadership is really important. So if you look specifically at cannabis, who some of the female leaders were, and it speaks to the medical piece, in ancient China, almost 5,000 years ago, we know that Emperor Shen Nung, put cannabis and hemp in the pharmacopoeia, the original document for Chinese medicine. Now, Shen Nung, legend, but didn't write those stories originally. It was a capture of things that had been verbally communicated for hundreds of years before, maybe thousands. So it's a great capture. Now, in there, if we have a look at cannabis and how they were using it, the format they were using was tinctures. Now, a tincture is like you take cannabis oil and you suspend it in alcohol, which preserves it, and then you drop it under the tongue, for example. Commonly today in cannabis, people use oils rather than tinctures. They've moved away from the alcohol bases. One of the reasons is that cannabinoids, which are the medicine inside cannabis, are lipid soluble. They love fat. So if we can suspend that medicine in fat, it means we get a better outcome and a better medical product. So back in ancient China, women were creating tinctures. Then in ancient Egypt, actually the goddess Seshat, who you can see in hieroglyphs, appears with a cannabis leaf above her head. Now, decoded, that means there was a real acknowledgement of women who work with or commune with cannabis have a connection to a higher power. Okay, it's a godly or a goddessly connection. And then if you think about, the female physicians in ancient Egypt, they were doing incredible work. In fact, it was in 1550, I believe, that the first ever cannabis suppository, which some know as a pessary, it's a vaginal suppository, was created to address period pain or actually pelvic pain, which can include endo, PCOS, obviously primary dysmenorrhea as period pain, and other pelvic conditions. So, 4,500 years ago, women had this on lock. Okay. And then even the example, like a day-to-day example of how women led cannabis, Victorian England was one of the most cannabis-friendly societies at any point in time. We know Queen Victoria. Everyone loves the Queen Victoria story because it helps debunk the idea that cannabis is just a drug used for recreation. In fact, it's not. So Victorian women were expected to keep a cannabis plant in their home, usually in the kitchen, to tend to their family's ailments. It was so common that there was a book released, a journal released, which was like the Good Women's, Victorian Woman's Guide to Being a Good Woman, words to that effect. And there was a whole chapter on cannabis and how to use cannabis. It was socially expected for women to be aligned with it. So women have worked with and led the cannabis conversation for such a long time. And unfortunately, that's 5,000 years of history. If you go all the way up here to the 99% of that time, we hit the Prohibition era. Now, society loves to demean women, to punish women, and to use us as objects. Imagine, groundbreaking news.
Crazy.
Right? But here's a really good example of it. When Prohibition came in, and we'll talk largely about the States. Prohibition came in Europe with the witch trials. And in fact, there were 2 papal decrees written by Pope Innocent VIII. And I don't want to nerd out too much on the history, but I do love it. Because I feel like it connects me and my work to all of these incredible people. But Pope Innocent VIII, nightmare. To kick off the witch trials, sent out a papal decree essentially saying that anyone worked with plants or plants medicine was a witch and was to be burned. 75,000 women over a couple of hundred years were burned for working with plants. Not only did we lose their plant medicine knowledge, noting that the whole village went to them for medical care, we lost generational wealth around women's health. It's the equivalent of taking every OBGYN on earth or in Europe, burning them, and then going, okay, guys, well, we've got no experts left about women's bodies, but that's okay. So that was the first one. Then we get the hit kind of, over 100 years ago in the US when prohibition became a thing. It was very successful propaganda. I mean, really, it was the most successful propaganda of all time. And what was women's role in it? They made women the Madonna or the whore. If you didn't use cannabis, if you were the marrying type, if you were good and compliant, you were the Madonna. If you used cannabis, you were a whore. And how they demonstrated that is by sexualizing women. A quick Google of prohibition posters will show you negligee-clad women with their backs arched. She should have said no, but she didn't. And this real blame culture. So how they used women in propaganda was to demean women and sexualize them to try and scare other women into compliance. And now rebuilding the idea of who women are and who women are with cannabis, well, that's our job, and that's my work. That's what I do. My passion is to unravel that ridiculous propaganda and to have people reimagine and reconceptualize and understand the importance of the relationship between women and cannabis and the work that we're doing, which is incredible.
I mean, there was some of that history that I didn't know, and it is still quite shocking how to this day we're in 2025, almost 26, and yet those images of women are still used.
Yeah.
And it's just mind-boggling that progression. It's made its way, but I mean, we're still kind of we're still dismissed as just our problems are too much. They're too complicated. Hormones, all that stuff. Like a lot of our listeners may be curious about cannabis, and I hope that they are. And there is a lot of mixed information out there, but major health organizations like Harvard Health and National Institute of Health show substantial evidence that cannabis is an effective treatment for chronic pain. And here's mind-boggling, it might be better than opioids. So I want to ask, what are the biggest misconceptions you see when it comes to this topic? And how do people make sense of these mixed messages in a safe, balanced way?
It's a great question, and I absolutely agree with you. I hope people are curious because cannabis is not for everyone. Just like not everyone likes the smell of roses and not everyone eats capers. Cannabis is not for everyone, and everybody, as you rightly said at the beginning, when we started, everybody is different. Okay, so that's why we do the research to understand more broadly how cannabis works with physiology, with the body. So we can get a framework of understanding, and then that can be contextualized and be delivered as person-centered care by practitioners, but we need the research. So just like in all research, where women are underrepresented, and we know why that is. We know because it was men who were academics, it was men who were doctors. And why wouldn't you just research what you know? And yes, of course, there's too much variability with hormonal cycles, et cetera, et cetera. Sorry, girls are too hard. Okay. So really, it's the same thing with cannabis, is that we need to make sure that the research that is being done is inclusive of women. And I genuinely believe, and this comes from an informed place, that the number one condition that can relieve burden on the health system, that can reduce pain, that could be almost cured with cannabis is primary dysmenorrhea, which is period pain. Now, it's closely related to endo in that you've got chronic pelvic pain. These are chronic conditions, and often women who end up 7 to 10 years later with an endo diagnosis have primary dysmenorrhea or chronic pelvic pain in the meantime, and we don't know that it's endo. So there is a lot of overlap. So I think it's relevant for here. So what I'd like to do is, if you'll allow me, is explain how cannabis works with the body to treat primary dysmenorrhea, because what it will do is it kind of unpacks for people how cannabis works as a medicine.
Please.
Great. So the first thing to know about cannabis, if you are absolutely cannabis naive, is that it is just a flower. Cannabis is a plant. There are 2-3 species of cannabis. One is cannabis sativa, one is cannabis indica, and one is cannabis autoflower. Now, in terms of, that is the taxonomical definition going all the way back to plant biology. Today, there has been so much crossbreeding and cultivating, which is a wonderful thing, that really we talk about cannabis now as being indica or sativa, dominant or leaning. The main differences that you'll be familiar with, and if you've never heard of cannabis, this is just a really good basic ABC to start. Cannabis sativa traditionally is uplifting. It's something you would have in the daytime. It sparks creativity. It doesn't make you tired. It can energize you. So what you get with cannabis sativas typically is a really functional kind of medicine that you can use in the day that won't put you to sleep. That is still an analgesic in many cases, or pain relief. A cannabis indica, more traditionally, is, well, there's a saying. We say sativa in the streets, indica in the sheets, or indica in the couch. They're cute little ways to remind you that indica tends to be more sedative. And the plants look different. Sativa plants are very tall with very wide kind of fan leaves. Indica plants tend to have darker leaves. They're shorter, they're bushier. So, but as I say, today there's a lot of difference. Now, regardless, an autoflower we don't use for commercial medicine. It's not consistent enough. So with a cannabis plant, regardless of whether it came from a sativa or indica lineage, the only part of that plant, some caveats, but the only part of that plant that is medicine or that holds the cannabinoids is in the flower and only in the female plant. Okay. So people use feminized seeds to grow female plants, and it's only in the flowers of those plants. Now, that traditional fan leaf that you see everywhere, that is a part of the plant. In India, that's the only part of the plant that is legal to use medically. And there are medical benefits of hemp, absolutely. But I'm talking about medicinal cannabis used as medicines in medical markets. So, flower of the female plant. That flower, it's like having a pharmacy in a flower. People think of cannabis and they think, oh, THC, it gets you high. I'm just going to eat Doritos and have a giggle. You may well eat Doritos and have a giggle, but that's only if you are focused on, listen, I've had my share. But what people don't realize, and this is the greatest misconception, this comes back to your question, what's the greatest misconception? People think that cannabis is a drug that people use to get high and maybe help them sleep, and it's one thing and it does one thing, okay? That's not the case. There are over 300 active compounds in that flower. So if you have a look at a cannabis flower and you zoom in close, you will see trichomes. Trichomes are what make it look frosty. They're little mushroom-shaped resin glands. Inside those glands is the medicine. THC lives in there, the only cannabinoid with the euphoric effect. CBD lives in there, CBG, CBN, and 150 other cannabinoids. We're on our way to 150. Also, all of the terpenes, which are the essential oils, are in there. And terpenes are really interesting. And for those who don't want to dip their toe all the way into cannabis, we can talk a little bit about terpenes, which are essential oils that are common to both cannabis and other plants. My favorite example, linalool. It's in cannabis and it's in lavender. So there's a lot of therapeutic pieces within cannabis. Yeah, see, these are the things. So people think, oh, cannabis, it's something you buy from the guy down behind the bowling alley and it just gets you wasted and you'll have a giggle and you'll look like a dropout. It's not the case at all. it is a pharmacy in a flower. It is highly scientific. And for those who understand it, it's highly regarded. So now, how does it work with the body, right? How does it work as medicine? So within our bodies, we have a range of systems: reproductive system, respiratory system, nervous system, etc., all the familiar ones. We also have a system called the endocannabinoid system, or ECS. That system was only discovered in the 1990s. For 5,000 years, we have used cannabis as medicine. We didn't know how or why it worked with the body, but it does. We knew that it did. And in the 90s, we found out why. So the reason the ECS, I believe, took so long to discover is because it's not sitting in there with a big juicy organ that you can look at. You know, if you're a Victorian doctor and whatever, you can't see it initially unless you're really looking for it. But what the system is, it's made up of really three things: receptors, CB1 and CB2, that live in our synapses. Our synapses are within our nervous system. They live, those receptors, so where cannabis is received, is in the brain, the spinal cord, and then distributed throughout our bodies in other organs, with a very large portion in the female reproductive system, both receptor types. Those receptors, we need something for them to receive. So we have endocannabinoids. Think of them like a neurotransmitter that kind of works in the same way as a neurotransmitter. Our body goes, cool, I need serotonin. We have enzymes that generate that. And then we have receptors that pick it up. That's great. And then when we're done with it, we have receptors that reuptake it or enzymes that break it down. Same deal with the endocannabinoid system. So you've got receptors and you've got endocannabinoids. The one you'll remember is, well, we call it the bliss molecule, and it's anandamide. So anandamide, and I'm trying not to geek out too hard, but anandamide is also the thing responsible for the runner's high that people talk about. So how does cannabis work? Yeah, right. So then the third part is the enzymes that generate or synthesize and then break down the endocannabinoids when we're done. So how does cannabis have anything to do with that system? Note the name, endocannabinoid system. Endo, internal, cannabinoid system. What do we find in cannabis plants? Phytocannabinoids, plant cannabinoids. Every mammal has an ECS. So in principle, cannabis may work for any mammal on Earth. I know that's a lot of info. So tell me, is that, I imagine you would agree that there's not a lot of understanding about that out there, right?
No, there's not. And it needs to be out there. And I love that you're geeking out, because like just listening to you, I'm geeking out, and I'm like, because I'm such a huge fan of cannabis. And like for people with conditions like endometriosis, PCOS, so much of that learning about cannabis comes from community or from podcasts or social media, and the research hasn't caught up. So where do you think the science is heading, and how do you see emerging evidence bringing in that gap?
Yeah, well, I mean, it's a great day today to be recording, because I woke up this morning to the news that cannabis has now been rescheduled in the United States from has been rescheduled down to Schedule 3. Now, that's not perfect. Okay, we would rather it be descheduled entirely, but it means that in the States, cannabis, as of a few hours ago, cannabis is no longer considered a drug with no medical value, and there will be investment in research. So while a lot of the group chats have been going wild this morning, and not everyone's thrilled, right? Not everyone is totally satisfied by the outcome. But I responded in the chat. I said, a starving woman doesn't deny a snack because it's not a full meal. So we'll take it and we'll build on it. So what does that mean, and where is the science going? Well, for the States, it's going to mean more research. And you mentioned Harvard before, and I have to shout out Harvard. They're one of the few American institutions who have done positive cannabis research, not had positive outcomes, they have, but but they have approached with a strengths-based approach. They've approached with a positive hypothesis on occasion. So Harvard do some wonderful work in that way. Where is the science going? I do think it will go more towards women. So there's a few major conditions that the research so far has showed us that cannabis supports. Okay, we know that in some cases it's good for anxiety, but in other cases it can exacerbate it. We know that pain and sleep have been well researched in cannabis, which is great. We always need more, but of course, those are the conditions that have been great. And now more than ever, I believe it's going to go towards women's health, and I'll tell you why. Women's health, women, as we know, have been undervalued, under-researched, underdiagnosed, and under-bothered with by the medical system forever. What that has created is a situation where now we have women's health conditions that, had they been managed effectively or researched appropriately 20, 50, 100, 200, 300 years ago, we wouldn't be in this situation. We wouldn't have 1 in 10 women in Queensland, the state that I live in, with endometriosis, because we would have had earlier diagnoses, we would have had earlier, potential, we would know more and we would know better. Now, we're not in that situation, and because it's women that have been ignored by the medical system, we now have women carrying the brunt of the chronic condition load globally. More women have chronic conditions than men across the world. In Australia, well, let's think about chronic pain. Globally, 34% of women live with chronic pain. 1 in 3 women lives with chronic pain. In Australia, it's 40%. I recently returned from Iceland. Wow. I was very privileged. I got to keynote the Icelandic National Hemp Conference a couple of months ago, and I did some research on population health in Iceland, especially around women. In Iceland, 80.4% of women, 8 in 10 women, live with chronic pain in their reproductive years. Mind-blowing. Mind-blowing. It is the perfect, the study only came out a couple of months ago, and it is the perfect, Iceland's wonderful. It's only got 334,000 people. They've got an all-female government. They've got 4 universities, despite their low population. It's a really interesting place, and it's a really interesting place to look at healthcare and chronic conditions. And Endometriosis Iceland, I got to meet the leadership team when I was there, and they're doing amazing things. So if anyone wants to know about how endometriosis is managed in Iceland, I can absolutely connect you. But yeah, so where do I think it's going? I think it's going towards women. One of the reasons is, we've ignored women forever. Now we have all of these women with chronic conditions living in chronic pain. We have to address it. What is our driver to address it? We're women. We're in pain. What is a government's driver to address it? Health system burden, health economics. It costs, in Australia, the economic burden of endometriosis alone is 9.7 billion. Okay, mostly 2/3 of that is made up by absenteeism, right? So absenteeism is where we can't present at school or work because of the pain of our condition. Now, I would love, and I am begging everyone who hears this to then go, what else does that mean for women? Because then when you go, so women have less access to education, less access to employment, which means less access to promotion. So our careers are disadvantaged by a health condition that is gendered, okay, because it hasn't been addressed. It is not right for women to be economically and socially disadvantaged because of a health condition. And the amount of solutions that are available for endo and even primary dysmenorrhea, even period pain, which 93% of young women experience period pain, debilitating period pain. It is not right for us to be socially, economically, and for our life building to slow down because of a gendered condition. So I really believe that cannabis is where we can have a huge impact, especially around primary dysmenorrhea and things like chronic pain, where women are dramatically overrepresented. And it all ties in, right? It's chronic pain, it's pelvic pain, but also no condition exists in a vacuum. So if you think about endo, and I am blessed not to have endo, but I have a lot of love and respect for the endo community. I genuinely do. I have a lot of friends with endo. I understand it well. And the thing for me that strikes me is that story of how a painful condition impacts a woman's social position. It just blows my mind. It blows my mind. It gives us an absolute disadvantage. So if we think about endo, it's not just the pain, okay? It's the anxiety that comes with it. It's the depression that can come with it. It's the sleeplessness that can come with it. And I know I don't need to tell you or your listeners, but for those who are listening, who are curious, who maybe don't know, endo is not just the one piece. It's all of the associated symptoms. So let's have a little case study. A woman with endo has pain, takes over-the-counter pain relief, and then there's basically nothing until surgery. There's very few solutions, medical solutions available, and we need to do more. And actually, that's where I think cannabis sits. So this woman, this imaginary woman, so she has pain. So let's say she's taking over-the-counter pain medication or prescribed pain medication because it's simply unbearable. Then there's anxiety that comes with that. So then we need to treat the anxiety. So a lot of women end up on antidepressants or having to have medications to support anxiety, right? Which is all great. I'm pro-medicine. I'm pro-everything. I'm pro all the things, and everything has a place, and it's good for us to have all these tools to choose from. But that happens. Then that woman has to miss work, has used up all of her leave, and so then has to go unpaid. And then there's the conditions of that, the stress that brings about. And then there's stress on a relationship. Do you know, I only learned a few months ago that when some women with endo orgasm, that it's really painful. I didn't know that. And I only learned that actually in Iceland. And I talk about women's health all the time. So that was mind-blowing for me. And then you think about the impact on a woman's relationship with her own sensuality, but then if she's partnered in a relationship, the impact on that, right? So endo isn't just kicking us in the vag from one angle, right? It's really going over it. So how can cannabis help? Now, there's a lot of research, and I will ask you to refer to the research, but what I'm going to share with you is both from research and anecdotally what I hear, speaking with patients and speaking with women in the endo community, and also knowing how cannabis works. So how does cannabis address pain? When there is at the site of an accident or injury in the body, we know that the body responds by sending neurotransmitters there that are going to set up the framework for that pain. So they're going to go, great, how intense is this pain going to be? What are the pain signals going to be? That work happens with the body. What also happens, though, is when someone is, well, even without using cannabis, our endocannabinoid system has anandamide that I mentioned before. When those neurotransmitters that will set up the pain signals travel, actually the ECS sends anandamide as well to modulate it, to go, okay, calm down. We probably don't need that much pain. Why don't we set up a different pain pathway, XYZ? The same thing happens when we're stressed and our body produces cortisol. Actually, the ECS sends endocannabinoids up to the site of where that cortisol is released, again, to modulate it, to mitigate it, to make sure, to calm it down, to make it less intense. So if you think about our ECS as the world's best babysitter, the world's best sidekick for everything else that's going on in our body, same thing happens with pain. So anandamide gets sent to the pain area, and naturally that modulates the pain experience. When people use cannabis, what we are doing is topping up or supplementing our system. So the ECS that has the receptors and the endocannabinoids, so you've got anandamide and AE2, effectively supplemented by anandamide, by THC, and also by CBD. So what we're doing is when we take cannabis as medicine, those little mushroom glands, the medicine inside, when we consume cannabis, we're supplementing and topping up that in our body. So when there is pain and when anandamide is sent, that's great. But what about if our anandamide is low? If we have supplemented with THC, then our body will function in the way it would have if we had a full anandamide load, right? So your body's going to do it anyway, but sometimes it doesn't do it that well. For pain, there's a lot in setting up the pain signals, but there's other bits as well. So often pain is caused by inflammation. Addressing inflammation is really important. That's something that cannabis does. Cannabis works as a whole system piece. It doesn't mask pain. It helps the body to set up a different framework for pain. And with chronic pain, which is where pain has lasted 3 months or more, or has extended beyond when would be expected, and that pain becomes chronic, chronic pain is when we become overstimulated to even non-painful stimuli. It's where we become reactive. We're on high alert for pain all the time. We perceive everything as pain. Cannabis is wonderful. Research has shown and patient-reported data shows that cannabis can be a wonderful solution because it calms that and it recalibrates our nervous system, bringing us balance. So that's how it works for pain more broadly. In the case of primary dysmenorrhea, period pain, where does the pain come from? Prostaglandins are released every month into the uterine lining to tell the uterus to contract, to drop off the lining for that month because we're not using it. That's normal. When periods become painful, it's because too many prostaglandins are released into that muscle. So the message is really loud. So that muscle goes, okay, here we go. We have heavy bleeds, we have heavy cramps, etc. We're going to have a period either way, but by managing the amount of prostaglandins that we have, we can help our body to not overexert and cause us pain. Prostaglandins are increased where there is inflammation in the body. So looking back at how do we manage inflammation, cannabis and CBD in particular are a really good way to do that. So if I'm using cannabis to manage period pain, I'm using it as a preventative to reduce my inflammation, to reduce the amount of prostaglandins released, to reduce the frequency and strength of contractions during my period, meaning I don't feel it. And I am living evidence that that works because that's exactly what I do. But when I have my period, I also am a little bit anxious. So CBD and THC work with serotonin receptors in the brain. So I will have more serotonin if I'm using cannabis, which will reduce my anxiety. We release cortisol through stress from the pain when we have period pain or endo pain. If I'm using cannabis, I'm topping up my anandamide so that when cortisol is released, and anandamide would usually travel with it, I am like supercharging my anandamide to tell that cortisol to calm down. So that's just 3. I mean, there are like 8 ways that cannabis helps period pain, but there's some of the examples that I are not common knowledge, and it's so important for women to understand how our bodies work.
But it's so important because, like you said, I mean, endo and chronic pain affects more than just, it's a vicious cycle and it's a domino effect. And everything that you just touched on is everything that I've experienced personally. And I had missed school, and as in my professional life, I think part of the problem is I pushed myself too much because I'm a woman, and there was that fear mixed in of being like, I can't call in because I don't want to be overlooked for a promotion, or like, I can't miss this much work. So it's a full system problem economically. And, you, like me, work for a system that has failed us. And it's so infuriating. And especially for me, just being that like something that presented itself when I was a teenager should have been caught, and it would have changed my entire life. And I don't know how it gets solved. I think it's because of people like you and people like me who sit here and use a voice and are advocating for women, because like I've said before, the louder we get, the less they can ignore us. Anybody who's listening to this who has any sort of chronic pain is 100% going to be able to relate to this. And I'm sure people are out there thinking like, okay, this all makes sense in theory, but like, what does that mean for me in real life? So if listeners are thinking maybe cannabis could be helpful to them, I want you to talk about what people actually need to know when experiencing it safely. Talk to me about, there's a lot of different, and I think you did touch on this somewhat, but there's a lot of different delivery methods like edibles, oils, and topicals, but also dosage, because it's such an individualized type of medicine. Talk to me a little about like what those different delivery methods are and the difference between them.
Perfect question. Because this is the bit that we often miss, because I talk about things and I forget sometimes that I go, I forget that I consider these things assumed knowledge, but actually a lot of people still think that cannabis is just dried leaves. They think typically, and it's not. So with medicines, look, this is how I would define it. Medicinal cannabis is a term we use for cannabis that is prescribed. Okay. So in America, that's a little bit different to Australia. In Australia, cannabis works to access any cannabis, including CBD, it must be prescribed by a doctor, but not like a recommendation letter and then off to the dispensary, more like traditional pharma. The doctor will write a script for your dosage, your format, your formulation, and even the brand of cannabis. So in Australia, that's how prescribed cannabis works in the medical market. Then you go to the pharmacy, you pick it up. We don't have dispensaries. In America, I assume most people know, but in case they don't, in America, if you're interested in accessing cannabis, depending on the laws in your states, you need to approval. Now, there are different conditions that are approved in each state, and the process is 2 steps. So the first step, well, is a few steps, but 2 main steps. The first one is you need to find a doctor who will write you a recommendation that approves you to use medical or medicinal cannabis. That recommendation gives what most people know as the weed card. Okay, it's not always a card, but their approval, that's like you're approved to access cannabis in this state. Now, some states only have medical. Some states have medical and adult use. Some states have limited medical. All right. But even in states where there is adult use, going through the medical route is actually always something that I would recommend. And there's a few reasons, and it varies state by state. But for me, the main part is the medical oversight and access to medical resources. So in the States, once you've got your approval and you're recommended, you then go to a dispensary of your choice. Again, some states it's only medical dispensaries, or you can go into any old dispensary. When you go into the dispensary, you have gone out of the medical system into a commercial retail environment. Now, some of the best, smartest, most wonderful people I know own or work at dispensaries. So this is absolutely not a blanket slag off of dispensaries by no means. But what it is it's not the medical system. So with some dispensaries, they will have a medical person on staff. They will have referral numbers, etc. But largely you're entering a commercial environment. And so the product or the medicine that you're going to choose, you need to be informed about so that you don't end up with the medicine that happened to have the cheapest wholesale price last week and they're trying to move. So we need to eliminate that. So right? So people need to be informed. So what can cannabis medicines look like? Now, all cannabis is therapeutic, in my opinion. Therapeutic in the sense that it does good for our body. Every time I consume cannabis, it does good for my body. It reduces inflammation. It reduces my anxiety. It complements my system. Every time I consume alcohol, which I do quite rarely, I'm not doing something good for my body. For example, I'm poisoning my system. I'm making my body work harder. So all cannabis in that sense is therapeutic. But in terms of medical cannabis, what does it look like? So there's a few main formats. And you get these formats in adult use as well. The first and the closest to nature is dried flower. Okay. And dried flower is where they pick the flowers off the cannabis plants that I spoke about earlier. Well, they actually pick kind of the whole plant and they typically hang dry it. There's a few drying methods. Mm-hmm. So it gets dried out. So it's just like having dried herbs. And then they trim it and they put it in a jar, and that's your medicine. Very close to nature. Nothing added, nothing taken away.
And then you smoke a blunt.
Beautiful. Yes, you do. Okay, so that's flower. Now, there's other versions of getting the medicine out of that flower. One of them is extracts. So that's resin and rosin most typically. Resin and rosin as extracts are fairly common in vapes. So you can have like a breath-activated vape, but also people will use them as dabs. That's more of a recreational thing. So if you hear resin or rosin, that's essentially, think of it as the honey of the cannabis flower. Then you've got your flower. The other thing people will see is oils or tinctures, which is where they ideally take all of the components of the plant. So full spectrum is where you take all the medicine within that flower and you concentrate it down. Broad spectrum is everything except the THC. So that's still good. And then there's isolates where they isolate one component, THC or CBD. Those can then be suspended in oil or alcohol to make an oil or a tincture. So you'll think of that as dropping it under your tongue. So you've got flower you can smoke, you've got oil you can put under your tongue, you've got extracts. Edibles are really popular and for very good reason. And medically, they're great for compliance. So compliance is, when a patient takes their medicine that they're supposed to take regularly, right? So because they're easy and they're sweet and they're fun, and usually they're a candy or they're a brownie or it's a lollipop, and more now beverages, okay? Mm-hmm. And beverages are also good. There's also wafers, which are dissolvable pills you can put under the tongue. There's puffers that are like an asthma Ventolin. And for women, suppositories or pessaries or vaginal suppositories. Mm-hmm. Actually, I like suppositories because it can go in the vagina.
I've used them. I like them too.
Depending. So good, right? So we've got those, then we've got topicals. And there's lots of other innovative formats, but basically you're either looking at smoking a flower, putting a bit of oil under your tongue, puffing on a vape, or maybe eating something. Each of those formats have benefits. They all onset differently. So I'll give you the very basic. With flower, you smoke it or you can combust it in a vaporizer. The onset is immediate. It will reach its peak in 20 minutes and it will last in your system about 2 hours. So for breakthrough pain, smoking cannabis or vaporizing cannabis flower is great because you get that immediate piece. Vapes you can use in the same way because anything that's kind of an oral inhalation will work very quickly, but it won't last as long. With oils and tinctures, and they're actually beautiful to use in conjunction, and my recommendation is don't ever use just one format. So if you've got immediate pain you need to address, you can smoke or vape. If you want to build up a baseline of pain coverage, you need to use an oil or tincture or an edible, which kind of works with the same system, because what those formats do, they take longer to come on, minimum 40 minutes, maximum 3 hours. They will peak at around 3 to 4 hours, but they will last in the system about 12 hours. So if you're in pain and having trouble sleeping and you take oil in the evening, that will give you that beautiful long coverage through the night. But then you have a cramp around 8 p.m. and then you inhale a little cannabis just to take the top off that pain. You're covering staying asleep, but also the getting to sleep and so on and so forth. You can using all of those things together is great. Also imagine having a suppository, which is brilliant. And then also a topical. I love a topical and I find them very effective. So they're your main formats, but there's lots of information online. Formats that I say, just make sure you've got something that's long acting to give you a baseline, and then make sure you've got something for your breakthrough pain. They're the key elements.
I think that was like a perfect breakdown, super helpful. As with any medication that you take, there's always side effects. So for those listening, can you break down some of the side effects that might appear with taking cannabis?
Yeah, absolutely. So the safety profile on cannabis is actually incredible. It is proven to be a very safe medication, drug. And that is evidenced by the fact that worldwide there has never been one single death attributed to cannabis alone, okay, to the consumption of cannabis. So 5,000 years of history and all the medical records that exist tell us you cannot die from taking cannabis, but you can feel like you're going to die. And the thing I'm talking about here is commonly known as greening out. It's actually cannabis hyperemesis syndrome, and it's where we actually overload our endocannabinoid system. So it's where our system is already too stimulated and we've got much too much of things and we need to get rid of them. So normally that results in throwing up, sweating it out, and feeling very anxious while it all happens. And I think the thing that people will recognize is, there's the common understanding, don't drink alcohol and then go home and have a joint because you'll green out, right? Because alcohol also impacts the endocannabinoid system. And then by mixing cannabis, it kind of goes over the top. So you have to be very careful you don't mix cannabis with other things, and that includes other drugs. And that's why having medical guidance or even a great dispensary tech is important. So the main thing that would happen is if you greened out, and it is an awful experience, it's where it basically feels like an anxiety attack and then you vomit for a few hours. It's pretty awful. It only happens when you overdose. Now, overdosing is literally that, taking a dose that is over what your body could handle. As I said, no one dies from cannabis. Now, other things that can occur, and that most commonly happens when people pick up a gummy and they don't know it's infused. They go to a party, they've been drinking or taking other drugs, then they take cannabis, their body's already overloaded. It's just one more thing to recalibrate our body. It just helps, it gets us to start vomiting or whatever. So overdosing typically happens when people don't understand how strong the medicine is, or in fact that it even is medicine. So that's why packaging and labeling is really important, and understanding your dose. Most people medically will start on 2.5 milligrams as a starting dose of THC, which is very low. I consume cannabis. I've got a number of conditions that I manage: ADHD, comorbid anxiety, I've got level 1 autism, I've got complex PTSD, I've got primary dysmenorrhea, and I'm just very charming, obviously. Imagine. So all of those, I'm also in perimenopause, right? I'm also in perimenopause.
Well, I'm in menopause, so welcome to the club.
I mean, not a fan, but I'm here, so it's fine. So I use cannabis to manage all of those things. Now, I consume cannabis most nights of the week. I would say I can't remember a week where I didn't consume at least 5 nights, okay? Most weeks it's 6 to 7 nights. Around half of those nights, I will use an edible because it's easy, it's quick. I pop it in my mouth while I'm cooking dinner and I'm nice and relaxed and ready for bedtime. I get a great sleep. My neurotransmitters clear for the next day. I wake up fresh. So that works well for me. On other nights, I will smoke, and typically I'll smoke a joint. Now, in terms of how much I consume, remember I said that the initial dose most people medically start on is like 2.5 milligrams. So for me, even though I consume almost every night, my typical dose is around 10 up to 20 milligrams. Now, there are people who are consuming far, far more. I'm very considered and conscious of my relationship with cannabis, and I take the minimum effective dose to do what I need. Now, I do have to share one really important thing that I want you and all the listeners to understand. It's because no one tells us. No one tells us how responsive our body will be to cannabis is guided actually by our menstrual cycle and by the prevalence of estrogen in the body. So in our cycle, we have our 2 estrogen peaks, ovulation and right before we bleed. When estrogen is high, anandamide is high. Now remember, anandamide is our bliss molecule. So we've already got lots of estrogen, yay, feeling beautiful. Lots of anandamide, yay, feeling blissful. And then if we try and dump a whole bunch of THC in on top of that, it's too much. So when we are ovulating, I might only have 4 milligrams of THC. But when my estrogen is very low, I might have 20 milligrams. So the other thing, as you start to learn about cannabis and understand it, take note. And so many endo warriors are so good at journaling and keeping records because you all have to survive the system. So track that as well, but you will find that that's important. And to learn more about that, Dr. Shabnam Sashar, who is an incredible Iranian researcher who lives in Germany, she's brilliant. So have a look at Shabby's work. She talks a lot about that. She has a wonderful newsletter, and it really helps people and women to get to learn how cannabis works with their body. So it's really important that we understand that, like you said, everybody's different, but everybody is also different every day. Just to make it complex.
Totally helpful, I think, for everybody, even for me, because you just shot out some stuff that I didn't even really know. So it's all super educational and informative. Something I really have been dying to ask you since I reached out to you is, based on what you've seen in Australia, what differences do you notice between the approach to women's health and cannabis research compared to the United States? And what do you think that the US could learn or adapt to better support people with chronic conditions like endometriosis, PCOS, and chronic pain?
Great question. In terms of cannabis education and the role of women in leading cannabis education, research, knowledge sharing, etc., actually the States does it better than Australia.
Oh, okay.
You know, in the States, just around cannabis. Now, you need to look at people like, and that's just in comparison to Australia. Like, we could all do things better. And when it comes to women's health, we can all definitely do things better. Australia's research, there's not a lot of funding there for it, but there is really good research and more, I guess, per capita research going on in Australia at the moment than there is in the States. But in terms of, if you want to understand cannabis and you want to understand, like, especially as a woman with your condition, in the States, you have more cannabis nurses who have dedicated their careers to this than anywhere. In Australia, we have a handful, 5 or 10. We only have 27 million people here. Okay, so we're tiny as well. But we have a handful of maybe 5 outstanding cannabis nurses, 10 really good ones, and then there's probably another tier where there's 30 who are pretty actively engaged, and then there's a whole bunch who are doing the work but doing it more quietly. Literally, like in Australia, if you go, who's a great cannabis nurse, you could rattle off, everyone knows the names. In the States, you have Cannabis Nurses Network, you have American Cannabis Nurses, you have Cannabis Clinician Society, you have all of these amazing bodies where medical professionals and particularly nurses have gathered together to share knowledge. And the really beautiful thing is that the women who started those organizations are still around and still active. And I have to shout out Mary Lynn Mathry, one of the absolute OGs, Heather Manis. Oh my God, so incredibly impactful. And then all the way through, you have a look at some of the emerging nursing voices. I mean, you've got Professor Jana Champagne. She was a nurse, and then she kind of moved out of nursing. She gave up her license so she could do more activism. I mean, there's so many, I just could name 100, but there's some really good emerging ones. Look at cannabis nurse Sammy Pyle. She is finding new and innovative ways to reach audiences. Her Instagram is fantastic. She also runs workshops, and she also works in mainstream nursing care. There are just so many amazing female nurse voices around cannabis in the States. And if anyone needs a point towards any of them, I will happily give it. In Australia, we don't really have that. In America, you have a lot of women in cannabis groups. And I know because I'm a member in most of them and because I love it. In Australia, we don't have one, right? I acknowledge the irony that I stand here going, we don't have one, but also I haven't made one. So, like, fair enough, right? I'm as guilty as anyone. I'm kind of busy. You know, the other thing that you guys do really well is that you gather in community well. And the reason you can do that better than us is because you do have adult use as well. So in Australia, you can't have a cannabis gathering because our regulators say, well, that's like calling everyone into a room for a methadone party. Like, and I see how I understand their lens because it is still a very tightly controlled medical substance here. So actually, you guys do medical cannabis culture really well in the States, and you have some amazing leaders who you've still got the old guard there, which is like incredible. And actually, a lot of this is what I cover in Cannabis Queens because I talk about who are the women and what are we doing. So this stuff I've got so much love for these people who have just been doing it forever.
It's actually like really great to know because I didn't know that. And so thank you.
I'm going to introduce you to some amazing people.
Please. I'm so excited. Like I could talk to you literally for like 5 hours. You are so smart. And just like the second I saw you, I was like, I have to have her on my podcast because I think the importance of bringing both Western and Eastern medicine together and combining them for me personally has been so beneficial. But I think so many people out there are just so focused on the stigma that cannabis brings and the fear of doing it wrong. And so you just totally explained it in a way that is approachable and evidence-based, and it was great. And I just want to thank you for being here and bringing so much of that clarity to me and our listeners. But before I let you go, please tell everyone where listeners can find you, connect with you, learn about your work, buy your book, Cannabis Queens, and dive deeper into resources if they need to.
Thank you very much. I would love to. And I really love to connect. So I really genuinely say, please connect with me, connect with my links, but also reach out if you have questions. And I'm always happy to introduce people. I'm just a girl. I'm just one girl doing this over here. And as much as my capacity allows, I just connect with all of the other just a girls. And between us, we are womanhood, right? So please do reach out. The first place that you can find me is professionally is on LinkedIn, just with my name. And I have Melanie Wentzel Consulting as well, where I do consult both in the States and the UK and in Australia. So LinkedIn is a great place to connect with me. I also started a YouTube channel a couple of months ago where I deliver lots and lots of snippets of talks that I've done or documentaries I've recorded, and it's very much in the tone of this. It's like there's a great one, everything you need to know about cannabis in 11 minutes, which is basically my show reel, but it gives you all of these really great highlights. So YouTube is Melanie Wentzel Cannabis Queens. I'll send through the links. And then I have a website, melaniewentzel.com, and you can read more about me and connect there and connect through to the book. So currently, Cannabis Queens is only available on Google Play Books as an ebook, but I do have physical copies here. Next year, I'll be working out what I do with that. But if anyone has a special request for a signed physical copy, just email me through the website.
It's a great book, and I highly suggest people read it because it really focuses on not just the cannabis, but like women's health and women in general. And it's incredibly well written and really informative. And I'm kind of geeking out because I feel like I'm like sitting here on a podcast with somebody like super famous. And the fact that you even wrote me back on LinkedIn when I reached out, I wish you would have seen my face when you actually wrote back. I was by myself and I was like, my dogs like got freaked out because I was like, oh my God.
Honestly, I'm just a girl. I promise you. But it's honestly really nice to hear. I'm not going to pretend that's not lovely to hear because, I really care about what I do. So the fact that it's reaching people, and I don't just mean reaching their screens, I mean reaching people, that it's so nice for me to hear. So thank you.
Thank you. One of my biggest thing for starting this is exactly what you said. I love to help people. And I think it's really important to bring different perspectives into the conversation. And so I really wanted to have you on because I think for my listeners, it's something to explore because like we talked about, it's been around for thousands of years and it is medically proven to help with pain. It was beyond a pleasure to talk with you. And hopefully down the road, we can have you back on.
Thank you so much. I think you make such a great point. This podcast really are how this information is being distributed, because it isn't coming through other routes. So the work that you're doing is really so important and special. And it really is my honor to come on. I was very honored to be asked. I always think, my greatest privilege in life is having a platform and a stage to be a voice. There's so many people who are voiceless. So thank you. And I will come back anytime.
Yay! All right. Well, thank you so much. And Warrior Tribe, join me next time. And thank you again, Melanie. All right, guys, that is it for today's episode of Endo Warriors. Thank you so much for listening. And please don't forget to hit follow, leave a review so more Endo babes can find us. And tune in next time for a brand new episode. Bye.